my little grandchild, Lilia Ray. And you know what? It is important that we need to live longer to appreciate our family. If we don't take care of ourselves, if we don't get our yearly checkups, if we don't eat well, exercise, and laugh a lot. I laugh a lot, you know? Even when times that I was going through some hard times, I found time to laugh. We gotta laugh, right, doctor?
Absolutely. So as we were talking earlier, that it's very important for women who have breast cancer, one, to find a buddy or somebody who has had breast cancer to help them with the experience and help coach them with decisions and getting over the emotional turmoil.
That is true.
And I find some women want to just ignore their disease. They don't want any information, and I say, no, you need to be a student of breast cancer. You need to understand all these terms. You need to understand what the doctor's saying, because now in breast cancer we have so many different choices that we need to fit according to the patient's own personality,
that is true.
Their own sexuality, their own emotional tone, their own aversion to risk, and their willingness to take maybe innovative treatments and the unknowns around that. So unless one is informed and educated and understands what the doctor's saying, they're a passive partner.
That's right.
They won't get as good a care. But the other thing is, after the treatment is completed, many of our treatments now are long-term treatments. And women may need to take pills for years, and they need to get screening. Because remember, a woman who has one breast cancer is at the highest risk among the population for developing an opposite breast cancer. So you can't say after 10 years, I don't need to see the doctor anymore.
I had cervical cancer, I had breast cancer, that's right. Yeah.
But in fact, the risk increases with age as you're cured of one cancer of developing a second cancer.
That's true.
So therefore, screening and going to the doctors regularly for screening tests, it becomes even more important. So that if a cancer is detected early, it can be cured with simple, less radical treatment. And people then have more of the certainty they can stay with their family, watch their grandchildren grow up and get married and enjoy them instead of worrying about, well, am I going to make it to next year?
That is true.
So part of this is being informed and educated and taking responsibility for having their treatment and not ignoring the treatment recommendations because I feel so well.
That's right.
Because that's no data. I also wanted to tell your audience that we have a website that's free for patients with breast cancer and other cancers. It's www.patientresource.com. And you can go onto our website and you can download things about breast cancer, about survivorship, and so forth. And in addition, it has a lot of trusted websites. So if patients want more specific information about transportation, survivorship issues and symptom management, that they can go on that website and get better information than going on a Google search where they get hucksters and people on the first 10 pages.
Well, thank you.
So it's a joy to be here with you.
People
and I
of
really
Hawaii, remember this
love
man,
what you're doing.
He's awesome to come all the way to Hawaii and share with us about health and wellness. Remember now, cancer can attack at any time. We need to be prepared, okay? Smile, have fun, enjoy our life, enjoy this journey. Hui ho, until we meet again. Aloha.
Okay.
Thank you.